When Rob first came to you, he was talking about how he had some problems with his leg, that sometimes he just couldn't even stand up on it. What do you do in that instance when somebody comes to you with that issue?
Well, we have a lot of patients who have low back pain, disc problems, hip pain, or something called sciatica, which is when the bones move out of place and hits that nerve running down the leg. Can even end up in something called neuropathy. And so with the NUCCA procedure, it's a very gentle approach to realigning the entire spine and getting pressure off the nerves. So when someone has numbness, burning, pain in any of the extremities, after a period of time, they can not only get relief, but start to get function back. So they're walking, running, doing activities again.
And so it's a multiple procedures. This is something that people will come and see you a few times to...
Yeah, and unfortunately, the body fixes itself over time, and sometimes it takes its own sweet time. So our job is to lay out a plan with patients and be as clear as possible. When do you think I can start to wake up without pain? When can I start walking a mile or two? And then, Sean, when do we get to a point where we're feeling so good that we just want to maintain so it all doesn't happen all over again?
And something that we've heard from your patients today is that you really do sit down, take the time to listen to what they want out of coming to see you.
Yeah, we're going to listen, and I mean truly listen. The days of a doctor just running in, reading chart notes, and running back out, those are long gone. They never should have started. So it's interactive. I need to know everything that my patients have been through, and we want to set goals. I want to know that this is working if we decide to work together. So we set goals as far as when they want to get back to work, what they want to go do for travel, even things like holding their grandchildren longer. That's what it's all about, not just getting relief, but getting your life back.
And Renee and Dean, they both had separate issues that they came to you for. Dean had some paralysis in his hand. What's the first step when you have a patient who comes to you with something like that?
So when anyone has paralysis or numbness, burning, tingling, or weakness in their arms, hands, or legs, we're thinking pinched nerve, we're thinking disc problem. So in the exam, that starts to let me target the exam and target the digital x-rays we take. And the digital x-rays are a big key to everything. It shows me how to adjust the patient differently maybe than other chiropractors have or other doctors have treated them. So it really lets me get to the cause, get the pressure off the nerve so that the body can heal itself.
And obviously there's been tremendous success.
Yeah, well, a lot of patients are told they have to learn to live with things, okay, or told that there's no hope, and that's not necessarily true. We found that conditions such as pinched nerves, chronic pain, even things like headaches, migraines, neck pain, carpal tunnel, these things can heal if you just get the pressure off the nerve and off the disc and give it time without drugs and surgery.
And Renee, she came in with some pain in her hip, some mobility issues. That's again something that the NUCCA procedure can have a tremendous impact on.
Sure, and obviously with the NUCCA procedure, it's different than regular chiropractic. There's not going to be any manipulation, or as my patients would say, no twisting or popping. It's a very gentle procedure and what we would call very specific. So when I take the digital x-ray, it's going to show me the exact angles to adjust the spine at so that there is no pressure and there is no pain felt by the patient. It's just a gentle alternative to standardized chiropractic.
And I think it was Dean who called you the bone whisperer. He said you always know exactly where you need to go to help alleviate whatever issue there is. How is it that you know where on the spine to correct?
Well, the key is our 2-day workup where we're going to sit down on day 1 with the patient, take a full health history, and truly listen to their needs. We're going to do our exam, we're going to test their motion, we're going to check their spine, we're going to check their posture, and then the digital x-ray helps me key in. Day 2, we're going to sit down and go over all the findings. And I'm super straightforward. If I can't help someone, I'll let them know. And if we can, we'll make a game plan, cost coverage, however long it'll take, as well as things they can do on their own to help themselves down the road.
And the 2-day workup, that's a very important part of the...
Yeah, so the 2-day workup is the key to our success. It helps me see who I can help and who I can't. It's a great way to find out if we can help you and to lower the cost of healthcare.
And there For some people, there is a stigma attached to traditional chiropractic techniques.
Sure.
What do you say to them about NUCCA and how it differs from those traditional techniques?
You know, when someone gets hurt in a dentist's office, they just don't come back. When someone gets hurt in a chiropractic office, when someone gets hurt in a dentist's office, they just don't go back. When someone gets hurt in a chiropractic office, they usually end up here. Okay, and so we see a lot of these cases in people who've been told, don't go see a chiropractor. Maybe they've had surgery. Maybe they've been told they have to have surgery. Maybe they've been told they're too old for chiropractic because of their bones. They have osteoporosis. We can see all of those cases and a lot of times get people help where they've been told they have to learn to live with it.
And you can help with those issues that people have been told that they have to live with, but there are also some fringe benefits that come with the procedure. People notice that other things end up feeling better.
Sure, most people come to me with headaches, neck pain, back pain, pinched nerves, but the great thing about chiropractic, because we're aligning the body and getting pressure off the nerves, the body can heal things that maybe haven't been able to get fixed for a long time. We did a study with NUCCA that it helps high blood pressure equal to 2 medications. I don't claim to cure high blood pressure, but I can't tell you the number of times we fixed a bad neck, headache, or bad back, and other things get better.
And it was like Dean said, that the NUCCA procedure is great, but in the hands of Dr. Devin, it does what it needs to do. How important is it to have the doctor?
Well,
how important is the doctor aspect of this?
I went to my first chiropractor at age 2. At age 13, I told everybody I'm going to be a chiropractor. So this may sound corny, but I just believe I'm supposed to be doing this. Okay, and after 20 some odd years and tens of thousands of patients, hopefully I've been improving.
And how good does it make you feel to hear the success stories and to hear the change in quality of life that people have after coming to see you?
I tell a lot of my patients that there's really no need for me ever to retire. Helping people get their quality of life back, helping them relieve their pain, and not just them. Your pain affects everybody around you. So even though you could learn to live with something, people around you have to learn to live with you. So helping people and their families and the community is my mission.
And for people who have not heard of the NUCCA procedure before, or who have that pain but just don't know what to do, what do you say to them? If
you have pain or a health problem, or you've tried a lot of things, or even if you're a proactive person who believes in wellness and prevention, let's start with the consultation. I'll do a full workup to see if we can help. Obviously, if I can, I'll let you know. But if we can help, either solve something you've been dealing with forever, or head a problem off at the pass, even better.
And eat high quality fish?
Omegas. Get your omegas.
Awesome.
Good.